Welcome to Invest Health. I bet you didn't know that leukemia is a type of cancer that affects your blood cells. It is a complex disease that can have a significant impact on your overall health. It starts in your bone marrow, the spongy tissue inside your bones where blood cells are made. This is the birthplace of all your blood cells, including red blood cells, white blood cells, and platelets. Leukemia disrupts the normal production of blood cells. This disruption can lead to a variety of health issues, as your body relies on a balanced production of these cells to function properly. Your blood cells are essential. They carry oxygen, fight infections, and help control bleeding. Red blood cells transport oxygen, white blood cells combat infections, and platelets are crucial for blood clotting. With leukemia, the bone marrow produces abnormal white blood cells called leukemia cells. These cells do not function properly and can interfere with the production of normal blood cells. These cells grow and multiply rapidly, crowding out healthy blood cells. This overproduction can lead to a shortage of normal blood cells, causing various symptoms and complications. This crowding makes it hard for your body to fight infections, carry oxygen, and prevent bleeding. As a result, patients with leukemia may experience frequent infections, fatigue, and easy bruising or bleeding. There are different types of leukemia, and treatment varies depending on the type and severity. Some common types include acute lymphoblastic leukemia, chronic lymphocytic leukemia, acute myeloid leukemia, and chronic myeloid leukemia. Each type requires a specific treatment approach tailored to the patient's needs. Leukemia symptoms can be tricky. They often mimic common illnesses, making early detection crucial. If you experience any of these symptoms persistently, it's essential to consult your doctor. Fatigue is a hallmark of leukemia. You might feel unusually tired and lack energy, even after resting. Unexplained weight loss is another red flag. Pay attention to your body's signals. Frequent infections are common with leukemia because your body struggles to fight them off. Fever, chills, and night sweats can also signal that something is amiss. Diagnosing leukemia begins with a thorough medical history and physical exam. This initial step is crucial, as it helps the doctor understand the patient's overall health and any underlying conditions that might be present. Your doctor will ask about your symptoms and family history. They will want to know if there are any genetic predispositions or previous illnesses that could be relevant. A simple blood test is often the first step. This test can provide a wealth of information about your health, including the levels of different blood cells. A blood test can reveal abnormalities in your blood cell counts. For instance, it can show if there are too many or too few white blood cells, red blood cells, or platelets. If leukemia is suspected, a bone marrow biopsy is essential. This procedure is more detailed and can provide a definitive diagnosis. This procedure involves taking a small sample of bone marrow to examine under a microscope. The sample is usually taken from the hip bone and analyzed for cancerous cells. Imaging tests, such as X-rays, ultrasounds, or CT scans, may also be used. These tests provide a visual representation of the inside of your body. These tests help determine if the leukemia has spread to other parts of your body. They are essential for staging the disease and planning the appropriate treatment. Section 4: Early Detection, a beacon of hope. Early detection is paramount when it comes to leukemia. It serves as a critical first step in the journey towards recovery. When detected early, leukemia is more treatable, and the chances of successful outcomes increase significantly. Early diagnosis allows for timely intervention, which can drastically improve the prognosis. Regular medical checkups are crucial, especially if you have risk factors for leukemia. These checkups can help catch the disease in its nascent stages, making treatment more effective. These factors include exposure to radiation, certain chemicals, and a family history of the disease. Understanding your risk factors can empower you to take proactive steps in monitoring your health. Pay attention to your body. Notice any unusual changes or persistent symptoms, as these could be early warning signs. If you experience persistent symptoms that concern you, don't hesitate to seek medical advice. Early consultation with a healthcare professional can lead to early detection and better management of the disease. Early intervention can make a world of difference. It not only improves the chances of successful treatment but also provides hope and reassurance to patients and their families. Section 5: Seeking help, your path to diagnosis and treatment. If you suspect leukemia, the first step is to talk to your primary care doctor. They can order initial blood tests and refer you to a hematologist-oncologist, a specialist in blood cancers. Don't be afraid to ask questions. Understanding your condition and treatment options is crucial. Your healthcare team is there to support you every step of the way. Remember, you are not alone. Support groups and online resources can provide valuable information and emotional support. Section 6. Taking charge of your health. Knowledge is power. By being proactive and informed about leukemia, you're taking a vital step in safeguarding your health. Remember, early detection saves lives. If you have concerns, talk to your doctor. Don't ignore persistent symptoms. Early diagnosis and treatment offer the best chance for a positive outcome. Stay vigilant and take charge of your well-being. Like, share, and subscribe for more health tips and updates.